So I had a patient die on me the other day, and I think we should talk about that. What's up, y'all? This is Carolina Doc PT, and I had a patient the other day, as I mentioned in the intro, that passed away. And I'm going to try to do this without breaking any HIPAA laws or anything like that, and trying to not to give away any identifying factors, uh, for the family or anything like that, because I'm certainly not meaning to insult them or anything like that. This particular patient was very nice, and their family was very nice, and we had worked with them for quite a while. Well, on and off for quite a while, but I knew them pretty well. And this reason that this struck me m- so much is because of how this kind of all came about. Um, so this particular patient had had a knee replacement that didn't go well, and had wound up having multiple surgeries and multiple um, infections that resulted from those. And we were not with this particular patient from the get-go on this. They had already been working with other folks or other PTs for a little bit, and so then we got working with this patient after, golly, I think after the third surgery, I believe, and the patient was in a lot of pain, basically constant pain. Knee was constantly swollen, and the infection just was continuing to be present. And I, so I talked to this particular patient about um, the history. And the thing that struck me the most was that this patient had stayed pretty well with the same surgeon and the same practice despite all of the fails that had happened within the surgery and within the infections. And so there's a practice in our area where we practice that I've had some experience with that is um, really good. The patients that we have had that have been to this practice of orthopedist have had a lot of success. I've had patients from this particular um, orthopedist who had worked with infections and had had multiple infections and had come through that whole experience successfully. Um, so I tried to get this particular patient that I'm talking about um, to go to this other orthopedist to seek another opinion, just because of the knowledge that I'd had or that I'd gained about this practice from, as I said, some other patients that I've had. And so that's one thing that you don't really appreciate as a student physical therapist, but that you do as a practicing physical therapist is the reason this is called a practice is really you're learning from every patient. And so as I'm working with one patient, then I may experience something new or learn something new that then I carry on over to the next patient when I see them having, similarities to, the patients that I saw before. So you kind of have like an ongoing uh, improvement in uh, your education and how to treat patients as you are continuing to experience the kind of art of physical therapy practice. Um, and that's in addition to any continuing ed work that you're doing for yourself or journal articles that you're reading and all that type of stuff. So because I'd had these good experiences from these other patients, I thought, you know what, these other patients I'd seen had run into something similar. Admittedly, it was not quite as bad as this particular patient that we're talking about, but he the patient that I'm particularly thinking of that went to this orthopedic practice that had like he had a great success, and I remember him telling me about being on going to do his hip replacement after his knee had gotten infected, and like he's like, man, the floor I was on, every other patient uh, that morning that I was there had the same leg, the same issue. All were doing second redos, and it's it just spoke to the level of complexity that these orthopedists are used to dealing with. And so I was like, this particular patient now that I'm referring to, you know, they need to be seen by this practice because these guys, they're used to dealing with very complicated situations. And so I need to get this patient over in front of them. Um, so when that happens, like I don't generally call those when you can't, like I can't reach out to that orthopedist myself, because I don't have, when I'm going to another orthopedist that's not current with the patient, I really have no standing to be able to do that. So what I have to do is I have to go through the patient and I talk to the patient and try to get the patient to, be proactive and, seek this, these other physicians on their own and, then go from there. So that's, I spoke to this particular patient that passed away about going to see these folks that are used to dealing with complicated issues. And I explained, why I thought that it could be beneficial and, um, just how that it might benefit them. And when I was talking with them, as I said, this happened over multiple visits, and they were very interested, and they were going to seek them out. However, what wound up happening is this particular patient wound up going back to their the same surgeon that had been dealing with them throughout this entire experience, or pretty much throughout the entire experience. At least it was from the same practice of folks. And that particular surgeon put just a, or brought everything to a screeching halt with one question. And that was, well, because this particular patient asked the surgeon about going to this other practice that I was trying to get him to go to that's so used to dealing with complicated orthopedic issues. And um, that surgeon asked this patient, well, what are they going to be able to tell you that I haven't already? And that stopped the patient. And they decided they were not going to go any farther. And this, as I said at the top of this video, it wound up not going well. The infection could not get under control. This wound up leading to an amputation. That, um, unfortunately, led to more infections where that original amputation was, which led to a higher amputation, um, which led to continued issues with infections. And then there became some other, I think, health issues that got involved, and the patient wound up passing away. And I can't help but think what would have happened if that surgeon had not stepped into the middle of that situation and stopped their patient from trying to seek care from someone else who may have known more than they did about this patient's particular situation. And it is very frustrating as I think about that. And just look, I understand that surgeons typically will have big egos, and you want your surgeon to have a big ego. I mean, it's a they're big surgeries. You're doing a knee replacement, you're doing, hip replacements. I mean, these are big surgeries. There's tons and tons of money involved. There's risks. There's so many different risks that they're having to deal with. And so you do want your surgeon to have um, an almost an arrogant edge a little bit. Um, I mean, that's within reason, of course, and they certainly shouldn't have like a God complex, although a lot of them will, because they're not God. Okay, but they can be very very skilled uh, human beings, and so you want them to be very very confident about what they're doing with you. That said, if you run into difficulties and complications, you also should be self aware enough to understand that perhaps there are people that are more skilled than you are. And perhaps they can help your patient better than you can. And perhaps they are used to dealing with these types of complicated situations that arise with infections and all the things that go on with that. Um, Maybe better than you do, or more often than you do. Maybe they have that more experience than you do. So, so I say this. So why am I making this video? Um, well, I'm trying not to let myself get really mad at the surgeons involved and the practice involved. Um, but the reason I am making this and putting this out there is to, and I've made other videos about this, and I'm probably going to make more videos about this. This thing that I see within a lot of patients, which is they patients are not always very proactive about their health care. They trust other people's opinions so much that they often don't seek additional information themselves. Um, they don't seek out readily other opinions. They don't corroborate what they're being told. They just will blindly accept and then move on and trust. And they may put their trust in areas where it's not wise to do so, or it's not wise to do so without having a check on that. Because the thing that I think patients, I've been a patient myself, so I'm speaking to myself here as well. I think when it comes to healthcare and especially surgeries, um, you you buy in also into that God complex ego, and you want that surgeon to be you want them to actually be you want them to step in as God almost and fix your situation. And um, you don't sometimes realize that, look, there's only one Lord, and uh, none of us are Him. And you, we, we need to have a healthy bit of skepticism within our healthcare, and we need to double check what is being told by our physicians. You know, do you know do we need to research out the minutia? No, of course not. But there are ways we have information with, especially with AI now. You can go on to Grok on X and start asking them questions about your condition, and Grok will spit out some very good information. Huh. Um, and you can also double check the veracity of what the AI is telling you. You can do a Google search. You know, um, so the point of this video is you need to be proactive in your healthcare. You need to double check what it is that you're being told. Don't just blindly go on trust on every single thing. Um, or let's say this, go on blind faith initially. But if you run into problems, start seeking other information to help yourself. It's you are, I've used this analogy before, but you are not in a boat floating down a river without any oars or without any engine when it and that you're and as if you're just going wherever the river takes you when we're talking about your health care. It is your life, and you are in control of it, and um, it is up to you to seek information. It is up to you to seek care and appropriate care. And are when you are 2 and 3 surgeries in with an infection that has been present for 2 or 3 years, I mean, that infection, if it's not going to go away, so do something, do something new. Don't keep trusting the same people over and over and over again, the same people that made the mistakes the first time, because it may very well result in your life. Anyway, so I so I hope this didn't come across totally as the downer that it seems like, but I feel like I owe it to this particular patient and their family to try to put this information out there so that others can learn from that situation and hopefully, Lord willing, um, not go through the same experience themselves. So I hope that this has been beneficial for you, and we will catch you next time. Later.